Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. The West Virginia University Health System, which operates under the brand name WVU Medicine, is the state's largest health system and largest private employer. Comprised of 24 hospitals across 4 states and 5 institutes, and still growing, the past year seems to have kept pace with the last 10 years. So as the end of 2024 draws near, we thought this would be a good time to look back on 2024 and look ahead to 2025 for the WVU Health System. And who better to talk about the system's impact on the WVU Medicine family and the community than President and CEO of the WVU Health System, Albert Wright. Welcome, Albert, to Live Healthy West Virginia.
Good morning, Mary. Thanks for having me. You've been doing this for about a year. I was waiting for my turn, so I'm excited.
Yeah, well, we were saving the best for last.
Good.
So, it's been an eventful 2024. How would you characterize, in general, the WVU Health System?
2024 has been a good year for us. And if you think about it, in some ways, COVID feels a long way in the rearview mirror. In some ways, it feels like it was yesterday. And I would say, COVID and the pandemic hit health systems, very hard. It was difficult. And so 2024, I think, is the first year that's kind of felt normal to me and our leadership team and to a lot of our employees. So, and sometimes normal is not a bad thing.
Yes.
So I think 2024 has been a good year for the healthcare system. Lots of great stories, and it feels like we're kind of hitting our steady state, which is a nice place to be.
It's good to be back in normal, definitely. So what made you the proudest or impressed you the most over this past year?
That's a tough one. It's got to be the stories I hear. I have the benefit of getting to see the entire organization, all 24 hospitals, and I don't know how many clinics and other settings we have now, but it's a tremendous number all around the state and the surrounding areas. And we get to hear stories where folks go above and beyond every day. And I try to share a lot of those, but that is like fuel for me. That's invigorating for me. So to hear those stories and hear the great things we're doing, and we're always pushing boundaries at WVU Medicine. So that's fun. I also think sometimes we do things and our teams do it so well that you forget that it was a big thing. And so, for example, Peak Health launched in the last couple of years, and in 2024, we initiated our first Medicare Advantage plan, and we had a good number of folks sign up for that, and that's gone in a seamless fashion.
Great.
So it was a good year.
That's a big deal.
Yeah, it is. Real big deal.
Yeah. So what would you consider the biggest challenge of 2024?
Has to continue to be the labor market. That's one thing that's changed, that, just making sure we have enough good qualified folks to fill all our roles has been a challenge for the healthcare system. And we're not alone in that. I think that ultimately forces us to become a better and more creative employer to make sure we're adjusting, working conditions, pay scales, things like that, to make sure we're able to be not only the biggest employer in the state, but the best employer in the state. And that's always our goal. Yeah,
definitely. And it seems our system is always growing. But this was a big year for capital project announcements. So could you give us a little highlight reel of the building projects that were announced this year? Because there were a lot.
That's fun. That's fun. I love groundbreakings and ribbon cuttings.
Yes.
And so we're in a fortunate position to be blessed that we're a growing healthcare system, and we're a nonprofit healthcare system. So we need to make sure we have a strong bottom line. But once we get that strong bottom line, our job as a nonprofit healthcare system is to reinvest in our communities. So in April, our board of directors approved a number of really neat projects that really cover across the state. We announced that we're going to do an expansion of our Bluefield campus in the very southern part of the state and add on to that campus along with Princeton as well, where we're going to build a new 2 or 3 story cancer tower. Wow. That will kind of bring all of our cancer services into one spot, medical oncology, radiation oncology, the clinics and everything, inpatient rooms down in Princeton. So that's an exciting projects in the southern part of the state. We're also going to build a hospital without beds in the Elkins corridor. Mm-hmm. So I think that's like a $37 million project. Mm-hmm. And that's they've already topped that out, and it's going to be open by next year. So that's fast. Maybe the fastest project we've had. Mm-hmm. We announced some more investments in our Fairmont Medical Center. And that's a neat story because we're taking an old hospital that had really hit rock bottom, closed. The physical plant had a lot of deferred maintenance, and we're kind of rebuilding that hospital in place. And now, we're consistently running a census there of 50 or 60 patients, and we're going to be opening some new operating rooms. We just opened some new gastroenterology suites down there, so investments in Fairmont. And then the big one here up in Morgantown, we're going to relocate the Eye Institute and rebuild it here right on the corner. So it'll be a magnificent entrance in the campus, and it'll move all of the exam rooms and academic offices, and we'll add operating rooms to the Eye Institute. So this is going to be a big building, and it's going to be a one-stop comprehensive center for ophthalmology care. And there'll be a big parking garage attached to that as well. We always need parking, yeah. And this also just seems to be part of the mission, of delivering healthcare to all the places that it's needed. So not everybody has to drive 3 or 4 hours to get top-notch healthcare. There's a lot of care needs in the state, and we're a very large organization, healthcare system, but we're different than a lot of healthcare systems. Most systems our size are in an urban core, where you've got millions of people within 20 miles of the academic medical center. Mm-hmm. That's not us in West Virginia. No. So, we're going to provide high-level services in Morgantown, but increasingly our focus is going to be on moving as many services out into the communities, into those regional cities across West Virginia that we can. And I think some of those capital projects we approved last year are great examples of that. Oh, definitely. So how would you say the system did financially in 2024? I think we did well. We're probably going to end up with about a 2.5% operating margin. That's and, right. In these days, just as a nonprofit healthcare system, to have a positive margin is a good thing, because not everybody does. So we're blessed there. I don't know that we're ever going to have the highest operating margin of any healthcare system, and I know that that's our goal. But we're going to finish up a little ahead of budget this year, and that's always where we want to be. And probably the good news, Mary, is that we've had a lot of hospitals join our healthcare system over the last 4 or 5 years, and a lot of those hospitals were struggling. And the good news is we have a positive operating margin, and all of those hospitals have now become profitable. So that bodes well for the future for us to continue to be able to reinvest in our facilities and our people. That's no small feat, definitely. A lot of hard work. Yeah, so that's a look back on 2024. Now let's take a look ahead. Let's talk about 2025. What are the biggest changes we'll be seeing in 2025? We're going to make some significant investments in our people, especially around premium pay for folks that work off shifts. We're going to be able to give everybody a raise at the beginning of the year, which is always nice. Oh, we always like that. We're going through our second open enrollment for Peak Health Medicare Advantage, and knock on wood, that's going very well. But the big exciting thing in 2025 is going to happen right on January 1st, where Wright Medical Center who is a great friend and affiliate of ours for a number of years, and my good friend John Frankovich is the CEO there.
Okay.
Will be joining the healthcare system as a full member, and that really checks a lot of boxes on meeting our mission as the academic health system of the state. Right, Weirton is a part of West Virginia in the Northern Panhandle. They have a great legacy and history of taking care of folks, and this is a partnership that's going to be a win-win for, I think, both Weirton Medical Center and I know so for WVU Medicine.
Excellent, excellent. Now, I remember interviewing you 10 years ago when you first came here, and I remember you telling me, this is going to be a campus. It's going to be like, we're going to have a cancer center and a neuroscience, and you had a big vision, and we got it done, which is awesome. So I understand you have another 10-year plan in the works.
Yeah. So that's fun to talk about. So in July of 2014, about a month before I actually started, I met with system leaders and some of our board of directors in a conference room at our UHC Bridgeport campus. And we worked on a strategic plan that I was essentially hired to implement. That was a 10-year strategic plan, and talked about a lot of things you just mentioned. Really transforming the Morgantown campus into a collection of subspecialized institutes, while simultaneously building out a network of hospitals and care points around the state. And that strategic plan has served us well.
Yeah.
What our leadership team recognized, and I agree with them, was we really needed to now kind of poke our heads up and say, is that still the same plan we need going forward, or is it time to revise that? So we worked with an outside consultant and a significant number of our health system leaders and our board of directors, and we created a new plan, an updated plan that's called WVU Medicine 2035.
Okay.
And it's not a radical departure from what we've done, but what it does, Mary, is it really focuses on building out breadth and depth around our healthcare system, right? So, all of our hospitals, especially our mid-sized hospitals, those 200-bed hospitals like, Martinsburg and Wheeling and Bridgeport and Charleston and Parkersburg, we add breadth and depth of services. Again, back with that theme of taking care of more people, where they're at.
Right.
The 2035 strategic plan also leans heavily into our peak health venture and our integration as a payer provider. And, with having that alignment between the payment and the provision of care, what are the investments we're going to be able to make proactively to keep our patients and our population as healthy as possible and in the lowest cost setting? So I think these are going to be very good investments in our population health strategy, which is something that's very invigorating for our management team to think about. Finally, WVU Medicine 2035 really leans heavily into more electronic integration with our patient populations as well. We're a little bit behind in healthcare in that, I'll give you a couple of examples from other industries. If I'm looking to book an airline flight or a hotel or even a dinner reservation, I don't pick up the phone and call folks anymore. Right? I mean, this is all online.
Yep.
This is all through electronic communication. And I think it's going to be important for us, if we want to continue to meet our mission and be the best healthcare system we can be, we have to find ways to constantly communicate with our patients and make sure that we're allowing self-scheduling, we're getting people scheduled as close to home as possible, directing them to the right site. So a real heavy focus on electronic communication and integration with our patient population. And you hear a lot, younger people want that, not everybody. We'll still have other ways to communicate.
Sure.
But you know what? Our patient population is a lot more sophisticated than people realize. And patients of all age range want to be able to interact with us electronically or ask their physicians and caregivers questions.
Absolutely.
And we need to embrace that.
I love that with my chart. I mean, it makes a huge difference.
Exactly.
That's where we got to go, definitely. Is there anything coming up in the new year that you're really looking forward to?
I talked about Weirton. Very excited about that.
Yeah.
We'll see. We really enjoyed announcing those capital projects in April of 2024, the ones we just talked about a few minutes ago. We will make sure that we are continue to do well financially through the end of this year and get off to a good start next year. But we anticipate another round of capital projects around the state that we'll take to our board for approval again in April. I'm not going to tell you what those are today.
Okay,
because surprises are fun when you announce them.
Yes, that's true.
But we've got ambitious plans to make investments in the health of West Virginians and the surrounding areas we serve. And so we'll look forward to seeing if we can do that again next year. Okay.
So that's a little tease. Now, I imagine you anticipate the growth's going to keep continuing.
Yeah, as a healthy organization, you always want to be focused on either growth or excellence, or preferably both. So, we hope in 2025 we will continue to grow and we will continue to become more excellent. So, there are potential opportunities for more hospitals to join our healthcare system. We'll see if that works out or not. It always has to be a win-win partnership between those organizations out there that are looking for a partner, and it has to make sense, to meet our mission as the healthcare system. So we'll see if those happen. There's tremendous opportunities for growth in peak health, and as I shared, I think we're going to see a significant increase in the number of Medicare Advantage lives that we have. Our friends down at Marshall Health, more folks will come on to peak health as well. So I think you'll see growth in those areas. I don't know that there's anything that's imminent, but we'll continue to, we're always looking for opportunities to grow and get better.
I have to ask you this, though. Are there any surprises you can reveal that are coming in next year?
There are lots of surprises, but none of them going to reveal. None I'm going to reveal today.
I had to ask. That's my job. Of course. All right. So I always like to ask before we go, what's the most important thing you want our employees and the community to know about the WVU Health System?
That's a wonderful question. I always want our employees to know how much we appreciate the spectacular work they do. I mean, these are the most dedicated group of professionals I've ever worked with, and it's important for them to know how much we appreciate them, and that as a leadership team, we're here to support them. That's our job. From a patient standpoint, we're not perfect as a healthcare system, and nobody chooses to end up in a hospital or sick or need care, but we will be there when they need us. And, in our goal, we have two primary purposes for existence as a healthcare system. One is to improve the health trajectory of the state of West Virginia and the surrounding areas we serve. So we're here to take care of our patients. The second is to carry out the teaching mission of West Virginia University. So we want our patients to know that it is our deep privilege and honor to take care of them, and we're going to be here when they need us.
Excellent. Oh, and one more thing. Since you are our resident expert on KISS, do you really think they're retiring for good? I mean, do you think they'll come back again?
I love KISS, as you know.
I do.
If KISS can make another $5, they'll find a way to make another $5. So I would not be surprised if we see them come back in some way, shape, or form.
That's a fair assessment, I'd say.
Great ending question.
Yes. All right. Thank you. Thank you so much. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on the WVU Health System and the care it provides, visit WVUMedicine.org. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the new Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Albert Wright and everyone at WVU Medicine, thanks for joining us.